Hey, good morning to you. Thanks for joining us for the 9 o'clock hour of Good Day LA. I'm Michaela Pereira. Have you been feeling unexplained aches and pains during the pandemic? I get this crick in my back all the time now. Could they all be coming from the stress that we're feeling? We're going to have an important conversation about that mind-body connection and ways we can try and break the cycle. Stay tuned for that. Hey, up next, Maria, this segment, you said you wanted to pay attention to it. I'm giving you an alert. If you suffer from any kind of pain, that's a new one that's popped up during the pandemic, maybe it's chronic, maybe it's ongoing, you don't know where it's come from, our next guest may help provide some relief. We're going to learn more about the connection between pain and stress, and we're going to talk about solutions. Have you been waking up with mysterious aches and pains that came out of nowhere, probably during the pandemic? It may have to do with your stress levels. A study done last year showed that 8 out of 10 people were feeling more stressed out than usual. I know I'm not alone, which in 2020 only makes sense. Dr. Sheetal DeCaria explores the link between pain and stress. She's got a new book, Break the Chronic Pain Cycle. By the way, she is double board certified in anesthesia and pain management, so she knows what she's talking about. Dr. DeCaria, thank you so much for being here. So many of us, you've probably seen an increase in it, right? Patients that are coming to you saying, I don't know why. It can't just be age. What have I done? If I hurt myself somehow sitting at home in isolation?
Yes, absolutely. There's definitely been an increase in stress that I've seen in my practice.
Okay, so what I want to do, folks at home, we're going to give you a little quiz. No stress, no stress. You're by yourself, so nobody can see. We're going to do a quiz, 5 questions, right, Dr. DeCaria? And I want you to hold up a finger for every answer you answer yes to. Does that sound right?
Yes.
Okay,
that's right.
Hit us with the first question, Dr. DeCaria.
Okay. Do you suffer from headaches, neck pain, back pain, TMJ syndrome, bladder pain, or pelvic pain? The second question is, have you ever been diagnosed with depression or post-traumatic stress disorder? The third question is, think back to your childhood. Did you go through any really severe emotional trauma? Maybe it was a death of a parent or some form of abuse. The fourth one is, think about how you are day to day. Are you someone who feels always stressed out, always worried about something? And then the last question is, think back to when your pain started. What was going on in the weeks or months leading up to it? Did you go through a stressful life event? Maybe you moved, maybe you went through a divorce, maybe you lost your job. I know there's a lot of stress right now for a lot of other reasons, but just think back to what was happening in the days to weeks leading up to your pain starting.
Okay, Dr. DeCaria, I'm somewhere between a 2 or a 3. Like, I'd say 2.5 for me. So what does that tell you as a clinician?
Yep. So 1, yes. And, there may be a tie, but you don't really need to worry as much. When you get to 2, there is probably a link between your chronic stress and pain, but 3 or more yeses, and there's definitely a tie between your stress levels and your chronic pain. And what that means is that you really need to be addressing that underlying stress, because otherwise it's going to be nearly impossible to eliminate your chronic pain completely.
Okay, before we get to tips for people, because we're not just going to leave you sitting there in pain, honey. We're going to get to that in a second, but can you help us understand what it is in sort of layman's terms, that pain, that stress, how it can cause pain in our bodies?
Absolutely. So, when we think about stress, when we face a stressor, for example, maybe an attack, you go into that fight or flight mode. That elevates cortisol, that's sympathetic nervous system. What it does is tenses up your muscles, shifts blood away from your GI tract to your brain and your muscles, and you can face that attack. But what's supposed to happen is that stressor is supposed to pass, and your body is supposed to return back to a relaxed state. The issues that we see with our health is not just having stress, because stress is a part of life. The problem is when it becomes chronic stress and you're not returning back to that relaxed state. That's when you start seeing depression of immune system. You start seeing chronic low grades of inflammation, and that's tied to a lot of health issues, not just pain, but also heart disease, diabetes. So that's when we really see the health problems, is when your body's ability to regulate out of that state gets impaired.
That actually is really revelatory, because I think a lot of times people think it's mind over matter, right? If I just tell myself it's not a big deal, I can just kind of think my way through it. But your body is feeling things your brain might not even be aware of.
Right, exactly. And that's a result of all those hormones and chemicals that are being activated during that stress response. And you need to kind of develop better pathways to activate your resting system. And you have to do that through active, different types of things, because otherwise it's going to be very hard to return out of that state.
And let's just give people some grace here. We're all feeling it, right? All of us. There's
Absolutely.
been a lot in this last year. There's been a lot in the last decade. When you think of
Yes.
the increase in school shootings and the social justice issues and the killing of black men by law enforcement incidences. I mean, people's shoulders are way up here, right? Okay, so
Exactly.
let's start some healing, right? Let's not just leave people in that activated state. You've got tips to
Absolutely.
heal your brain pain. I like that you actually call it that, brain pain.
Yeah, because that's actually where our pain starts. You think about, into your finger and the pain receptors must be in the finger, but it's actually the brain and the way the brain is processing pain to you. And that's why it's so different from one person to the next. And, there's really easy things you can start to do now from home to help that. And the first one just being service. Now, volunteering has been shown in studies to make you live longer, stress less, and experience less pain. And we just saw the great segment on the LA Food Bank, who I'm sure is looking for volunteers. There's also those virtual volunteer opportunities you mentioned, or even simpler than that, pick up the phone and check on an elderly neighbor.
Yes.
Even these random acts of kindness can do a lot to just light up those positive emotional centers in your brain.
Write letters to seniors in seniors' homes. There's lots of, and you can go online and Google, ways to volunteer virtually. You make a very good point. There's something it does. It stirs a sense of purpose and a sense of I don't know, gratitude. And gratitude is actually the next tip you have, because if we can focus on what we're grateful for, that helps our brain, does it not?
It does. Studies have actually shown a 23% decrease in cortisol, that stress hormone, with simply just practicing gratitude. And it's free and it takes less than a minute. You can just wake up in the morning, think of 3 things you're grateful for, maybe the roof over your head, the food on the table, your loved ones that are still with you, and just write them down. Changing your mindset to be more grateful for your day is going to just change the entire outlook of your day.
Someone gave me a tip of doing a gratitude journal where you can write 2 or 3 or 5, whatever things down every day that you're grateful for. It's really a great practice. That old ruse of movement and exercise. Get the body moving. We know it. There's a connection.
There is, and it's same kind of thing with lighting up those positive emotional pathways. So right now it's really easy. We are indoors, but there's ways to get active without even needing expensive gym equipment. You can just watch a yoga video, start moving, take a walk outside. I really like a 15 or 20-minute walk outside to connect with nature, to just kind of bring yourself back down from that stress level into your resting state.
Getting outside and that fresh air and the sun on your face and smelling the earth and the air through a mask, but it really does help. Speaking of smelling and lungs, breathing exercises are super important. Some people may not get to the point of meditation, but you can even just start with breath work, right?
Exactly. So how you breathe is actually a reflection of what you're feeling on the inside, believe it or not. So when you're in that stress response, you're taking rapid, shallow breaths, and you may not even realize it. So if you take a moment, pause, and be really mindful about how you're breathing, take a big, deep belly breath. That in itself can be enough to tell your brain to relax and to turn off that stress response.
And then another aspect of the inside of us, a diet. You talk about an anti-inflammatory diet. That seems maybe complex to some. Break down what it means.
Sure. So really easy concept is that try to eliminate processed and packaged foods and try to eat more fresh fruit and vegetables. It seems easy, but they've actually done studies that have shown people eating even just raw fruit and vegetables are more likely to have less depression, less anxiety, and improve mental health scores. So something as easy as, instead of reaching for the bag of chips at snack time, maybe reach for an apple, put some almond butter on it, just making these little healthy choices. You can actually see a change in as soon as 3 or 4 4 weeks.
Yeah, someone suggested going shopping only the perimeter of the grocery store, and that way you get some of those fresh fruits and vegetables and not the processed food. Dr. DeCaria, I would love to check in with you again because this has been super helpful to folks. I know it has been to me. Maria, were you taking notes? I hope she was, because she was.
I had four fingers up.
She had four. Okay.
Oh, no.
Four fingers up. We may need to do a session with Dr. DeCaria. Or, by the way, Maria,
Absolutely.
we want to let people know you can pick up her book, Break the Chronic Pain Cycle. You don't need to live in pain anymore. Thank you so much, Dr. DeCaria. We'll talk with you again soon, I hope.
Yes, thank you for having me.
And you stay safe. Thank you.